Hello, I'm Adrian Brown, and I'm delighted to have this opportunity to tell you about the MAC's 2021 appeal. But first, perhaps a bit of introduction, as I'm aware I'm relatively new to the trustee board of MACs. I think Colin introduced me at last year's AGM, and as he may have said, I grew up in Malawi, so I knew it better than England for the first 20 years of my life, up to the early 80s. I joined Eileen on the projects trip last year, and while some things have changed, many have not, notably the lovely, friendly people. So I've taken particular responsibility for water and solar projects, and it's with that hat on that I'm talking to you now about our appeal for the coming year, which seeks to provide reliable solar power for the 3 health centres attached to St Anne's Hospital in Nkota. But first, a bit of context. As many of you know, Malawi is a country of around 17 million people, most of whom live in very rural settings. With only 26 district hospitals, most health services are provided by around 600 health centres. Now, these health centres, though often linked to a regional or community hospital, are typically pretty isolated. So they represent the only contact that most of the population ever have with the healthcare system, and they therefore play a critical role in improving the lives of millions of Malawian mothers and children. In part because of the lack of state funding, the voluntary sector, and notably the Christian one, plays a very important part in these services, and that's certainly where St Anne's fits in. Similarly, electricity provision, like many services, is minimal for the rural populations that we serve, where only about 2% of people are connected, as opposed to around 37% in towns. Fortunately, the timing of this project is very good. The Malawi government is currently trying to electrify all the rural healthcare facilities, and so there is funding to install proper lighting and other accessories. However, actual connection to the grid can take years, and the mains electricity supply, even when it comes, is not only expensive, but also pretty unreliable, with frequent power cuts lasting many hours, especially in the dry season. So, a reliable solar backup system providing essential power during these blackouts and reducing the cost other times is a real benefit for these health centres. So what are these health centres like? Well, typically they provide outpatient and maternity services, including in some cases emergency caesareans, as well as limited inpatient services. Again, mostly maternity and in the wet season, a lot of malaria and TB. Many of these services, especially acute maternity and the inpatient treatment, require 24/7 coverage, and so a good, reliable lighting system is a real benefit. When we visited Kapiri Health Centre, which I think is featured in the picture here, the nurse told us how she frequently had to deliver babies by hurricane lamp. In addition, much of the outpatient work relies on drugs and vaccines, which need refrigeration. Now, many of these health centres will have paraffin fridges, but these are unreliable and can mean a regular 20-kilometre bike ride to get more fuel. So again, a reliable source of electric power can really help here. And last but not least, mobile phones are surprisingly widespread amongst the rural Malawians, and they provide an essential lifeline of communication, provided they're charged. And this too, unsurprisingly, is a challenge for many rural Malawians. So, a reliable source of electric power can make a real difference for the doctors, nurses, and their patients in these health centres. Our plan, specifically, is to provide a robust solar backup power system for the 3 health centres attached to St Anne's Hospital in Nkota. We propose to install solar panels, battery packs, and a hybrid inverter to allow the batteries to be charged either from the solar panels or from the mains. These batteries will give the health centres around 9 hours of power, which should cover most of the blackouts and, importantly, last the night out. So hopefully no more babies born in the dark. It will also give them a reliable enough supply to run a fridge, and any other small analytical machines that they may have, for example, blood testing machines, as well as charging for mobile phones and a PC. Now, these 3 projects that we're talking about are already specified and costed, and so we're just waiting the funding for them to become a reality. Conscious of the strains COVID is putting on all of us, and notably on charitable contributions, we're setting a more modest goal this year than previously. Electrifying the 3 health centres will cost around £15,000 to £20,000, so we're targeting £20,000, with any surplus going to fund other solar electrification projects which may arise. And as many of you know, we've previously provided lighting for teachers' houses and classrooms, as well as solar-powered water pumps. And we already have a start in reaching this goal with £2,000 of funding from other Max resources, as well as from some generous donations specifically. As ever, we'll be taking very good care to ensure that your donations get used as efficiently as possible. We'll be working with the local diocesan organisation through its development officer, Oscar Mponda, who's the one with the big smile on the right here. Oscar has worked with Max for many years, most recently on some of the classrooms built under our recent appeal last year. And he has experience with other solar electrification projects, primarily in schools. And of course, our trusty Graphid on the left here will be our representative and will be monitoring progress on the ground, as well as controlling any disbursements to the project. So any donations that you make to the appeal can be made via the donate button on our website, where there is a special page for this appeal, or of course by cheque made out to Malawi Association for Christian Support. And please write 2021 appeal on the back to make sure that we allocate the funds to the appropriate appeal. In addition, of course, we also have our gift list, which, as many of you will be familiar with, offers a range of potential gifts, from hospital PPE to solar lighting and school fees, suitable to adjustable to fit any budget. And of course, if you'd prefer to donate by that means, we would also be very grateful. So all of these donations will be enormously appreciated by the communities and individuals which we support in Malawi. So it only remains for me to say thank you in advance for your generosity, and to leave you with a traditional Malawian gesture of appreciation from the women of the Mothers' Union of Diocese of Lake Malawi. Zikomo kwambiri.